Welcome, really, to the Ricky Matthews Show. And listen, once a week on Wednesdays, we're going to be focusing on this new series called Singing River Health Talk. And we're super excited about it. We're kicking off the new feature at the beginning of the show this week so you can have a full understanding of what we're doing. And then in the second half of every Wednesday show, it will be Singing River Health Talk as we open the show today. So we're excited to have them as a sponsor, and as we like to say, powered by Singing River Health System. You know, you've heard me on this show many times. The Singing River Health System is really the real deal. Longtime backers of my show. I've been in their corner for a very long time as well. They're not just a health system. They are a community heavyweight with their hands on the pulse of coastal Mississippi. This will be a weekly dose of excellent health advice backed by the best. Each week, we're going to bring health professionals to zero in on what keeps us ticking, practical stuff to help us live a lot stronger. It's a solid weekly addition to the show, and we're really pumped about it. And we think Singing River Health System is going to be a terrific partner. This week, we're going to focus on colon health, and we've got a really, really good first guest, and Dr. Ramon Brown. He's an experienced colon and rectal surgeon and a decorated United States Air Force veteran. In fact, he did some work at Keesler. We're going to tell his story, but before we go any further, Dr. Brown, how you doing, my friend?
I'm good. How are you this morning?
Good. How's your day been so far?
So far, spent a couple hours doing a couple of colonoscopies, and right after I'm done here, I'll go right back to it.
Well, listen, we appreciate you joining us, and we're excited about this partnership with Singing River Health System. Listen, I was really interested in reading your background, but as we were discussing before we started, you actually were born in Jamaica. Tell me about that.
Yeah, I was born in Jamaica, and we moved when I was very young to the United States, and to Virginia, and then eventually made my way down to Tampa, Florida, where I like to tell most people I was raised. I was raised in Tampa, Florida. Was a Floridian at heart, and from there, went to University of Miami for undergrad. Yep.
Yeah, and you ended up going to medical school at Morehouse School of Medicine in Atlanta, Georgia. And what introduced you to ultimately do an internship and residency in general surgery at Keesler?
So I took a scholarship with the Air Force to assist with payment of school, and one of my closer friends who was at Keesler kind of brought me down and put me underneath his wing, and I decided to come join him. And so that was kind of what brought me down to Keesler in the first place. And but yeah.
You know, we find this a lot, Dr. Brown, that people who come through Keesler end up settling here. I mean, I don't know how many doctors have gone through Keesler Medical Center and made a decision to just live here when they were done. But there's a lot of them, isn't there?
There is. It's kind of a jewel of a community, and once you kind of get here and you see what's going on, it becomes harder and harder to leave. And interestingly enough, like when we're in the military, people who would leave Keesler, ultimately they would come back either to serve another rotation or even retire in the local area. So it's kind of unlike anywhere else.
So when you got out of the Keesler Medical Center doing your residency and then of course continuing your career, what did you do between then and landing at Singing River Health System?
Well, I went to a fellowship over at Ochsner Medical Center for colorectal surgery, and then came back to work at Keesler alongside one of my mentors, and kind of started tailoring my career, which is more directed at doing robotic surgery and trying to use minimally invasive techniques to help solve many of the colorectal problems that we see. And we've had some reasonable success in terms of shortening length of stays, preventing infections, things like that.
You know, there's a lot more talk these days about colon cancer and colon health. I think that through the research, through the experience, we've and you mentioned robotics, we've gotten a lot better at understanding what the challenges are and being able to be really much more preventive in the way we deal with care. But early onset colon and rectal cancer is something that is treatable, but we have to find it early. Talk a little bit about that.
Right. And so, early onset colorectal cancer is part of the reason why they moved the age for the initial screening colonoscopy from 50 to 45. We were seeing that from 2020 on, there was a year-over-year increase in incidence of patients this population of 2%. And that doesn't sound like a huge number, but when you do that for about 25 years, it starts to become a little bit more and more obvious. And I'd have to say that I've seen more patients less than the age of 45 with colon cancer than I have at any point in my career. I'm kind of biased as I see, the colon cancer patients after they've had their colonoscopy, but this used to be a disease where I would rarely see a 30 or 40-year-old, and now it's something that I see quite regularly, unfortunately.
So what do you associate that to?
It's unclear. We're not exactly sure why this is becoming more and more of a problem. I think some of us theorize it's something that we're all exposed to, either something in our diet or in the environment that's kind of causing um, this increased rate of progression in these cancer patients. And quite frankly, sometimes these come at a time when patients are as young as 25, 23. Um, some of them have, some incidents in family history. Some patients have absolutely no family history is and are, otherwise completely healthy. So I think it's just important for people to kind of listen to their bodies. And if they're having, increased abdominal pain, bleeding, changing their bowel habits, then to talk to their primary care doctor or get a primary care doctor so you can, either get a colonoscopy or do a test that you're comfortable with.
The colonoscopy is kind of the gold standard, though, isn't it?
Yeah, the colonoscopy is the gold standard, but I honestly know that there's patients who are in the general population, it's kind of a black box. You go to the hospital, you do a quote unquote colonoscopy, and you come out the other end. There is some fear and some stigma associated with it to a certain degree. And I think one of the things I love to say is it's one of the best naps you'll ever take prior to having, a really unfortunate night of diarrhea. And so, getting that clean out process is probably the hardest portion, and the scope itself is actually pretty easy and straightforward
Yeah,
for
I've
the
had a couple
patients.
myself, and have been lucky to say that I've passed with flying colors. Have another one scheduled for next month. But I've tried to always be super preventive in the way I approach healthcare. The other thing I do is I've exercised for 45 years, literally nonstop for 45 years, and I watch my diet. My wife and I are really health nuts when it comes to eating. Um, but aren't you finding more and more people are doing that these days?
Yeah, we are finding that more and more people are doing it these days. We're seeing, a decrease in the amount of smoking. I think we're seeing more people vaping than we are smoking before, but that's a different story altogether. And I think, things that we know can kind of help prevent needing to see someone like me. Watching your weight and staying active, um, you know, having a high fiber diet, and kind of cutting back on the red meats and the processed meats and the ultra processed foods, cutting back or completely stopping smoking and drinking in moderation. There's lots of conflicting evidence. It used to be said that a glass of red wine a day is all right, and then it's now any amount of alcohol is unsafe. We just got Surgeon General's written statement saying something to that effect a couple months ago. So I know that that's confusing for patients, but I think moderating those things is probably for the best.
Listen, I've been reading a lot more about alcohol recently, just because there's a lot more being written about it. The impact that it has on REM sleep, of course, depending on how much you drink, it can create all kinds of different problems. But in your work, you see the direct damage that can be done from excessive drinking, don't you?
Yes, and it's not just health effects that are directly related to the colon cancer, but also the indirect effects of, well, now you have these other health issues. Either you have cirrhosis, and now for some reason you also have colon cancer, and it makes it more difficult to treat your colon cancer. Or you have some other disease, and now we go to treat that, and because of the excessive drinking, you end up having withdrawals while you're in the hospital.
Listen, we're visiting today on a new special feature that we're going to have every single week called Singing River Health Talk, where we bring in a professional and we talk about health and the kinds of things you can do to live a healthier life. That's what the goal is. We're excited to have Singing River as a partner in this effort. When we come back, we're going to continue our conversation with Dr. Brown. And I really want to dive into the robotic side of what he's doing, and we'll keep the conversation going. We'll see you after this break. Special new feature that we're going to have. It will be in the second half of every Wednesday show. Today we made it the first half because we're introducing something new in partnership with Singing River Health System, and we're really excited about it, where we're going to bring a health professional in every week and talk about things that can help you have a healthier life. And, what more could you possibly want? And I must say that, too, as I mentioned at the beginning of the show, Singing River Health System is a terrific leader in the community. And I couldn't think of a better health system to have a relationship like this with on the Ricky Matthews Show. So we're excited about it. So now we're going to continue our conversation with Dr. Ramon Brown. He's a terrific communicator, incidentally. He's a experienced colon and rectal surgeon, and as I mentioned, he spent some time at the United States Air Force, specifically doing an internship and a residency at Keesler Air Force Base, and so that's a really, really important regional medical center for the military. So we're excited to have him here with us today. Hey, listen, Dr. Brown, when we went to break, we were chatting a little bit about the colonoscopies. And, those of us who've been through it, the prep can be no fun, but the reality of the actual procedure itself is painless. And,
Right.
And people fly through it. I mentioned to you that I have a couple of my friends that are my age in their 60s and have never had a colonoscopy. I know you meet people like that every day. So why don't we have a conversation about why it's important to be super proactive when it comes to this, given the fact that colon cancer is so treatable if you can catch it early.
Correct. And so I think one of the things to know is that colonoscopies are one of the only screening tests that can actually prevent the disease that it is screening for. Because, as the saying goes, not all polyps become cancers, but all cancers that we are aware of come from polyps. And so if we are able to scope, and hopefully this makes sense, scope the patient and remove those polyps, that removal takes away that polyp's opportunity to become a colon cancer. And I've seen it time and time again where I've had patients who had a colonoscopy, had a recommended interval colonoscopy, say, hey, you're supposed to have your colonoscopy again in 3 years. It was missed. And then they come back when they're starting to now have symptoms, and they kind of missed their opportunity to get that prevention. And now we're just diagnosing and treating. And so it's one of those screening tools that can help prevent a disease process from kind of getting out of hand. Because a lot of times when it starts becoming symptomatic, then we're dealing with, maybe even metastatic disease, and that's definitely concerning.
Yeah. So let's talk about the recommended process for colonoscopy. So walk us through that.
So the recommended process for colonoscopy now is at age 45. Across the board, that's when we're supposed to start. Used to be 50, now it's 45. Sorry, guys who are just waiting until they were turning 50. You're 48. You're already past due. Let's go ahead and get that done. The next step is getting in with your primary care doctor, and they'll either send you to, someone who does a colonoscopy. There are surgeons who do colonoscopies like myself, but the primary participants in that procedure are gastroenterologists who do both EGDs and colonoscopies. And from there, you'll end up doing a bowel prep and then having your colonoscopy. And typically the colonoscopy takes somewhere between, you know, 10 to 15 minutes. So nice 20, 25-minute nap. Wake up on the other side of it, ready to go eat Waffle House or whatever you want. Because most of the time these things are done, really first thing in the morning so that you don't have to wait to eat. So it's a relatively painless process, but I understand patients' fears.
Well, I'm curious, and I'm sure the average person would be curious because I think it speaks to the reason why we should be preventive when it comes to our colon health. How often a week do you do a colonoscopy and you go, gosh, if only they had started this process, 10 years ago? How
At
often
least
do you
once a
say
week.
that?
At least once a week. At least once a week. To the
Yeah.
point where it's, some of those things where I don't think about it as much like that because passive prologue. But to me, I wish that people would recognize that more and help take care of themselves so that they don't ever really need to see me. If there was a pill that I could give people and it would cure their colon cancer, I would be the first in line, just chucking it out. Be like Mardi Gras parade, just throwing them into the into the crowds of people. But that's not the reality I live in, unfortunately.
You strike me as the kind of guy that would have a good relationship with his patients. For people who are watching on SuperTalk TV or on YouTube or Facebook, they can see you have a great smile and a good personality, but you seem to be passionate about what you do.
Yeah, I think how could you not be? I mean, this is one of those things that it's not necessarily fun to or easy to talk about. And so making it fun and making it easy and kind of keeping it smooth for the patients. My passion is for the patients who do develop colon cancer, and need someone to provide them with a plan that's going to get them through a relatively scary time in an easy way, so they can get back to living their life and going to work and taking care of their family, and with a new perspective that this is our one shot. This is what we got.
So as you watch the advancements of robotic surgery,
Hmm.
you probably had to be thrilled that you could be less invasive. Well, talk to us about it.
Absolutely. So one thing I want to say is I love open surgery. It is one of my favorite things to do is to have hands-on tissue and do that work. However, I will say that my big old size 8 hands really don't need to be doing open surgery if I don't have to. All of that surgical trauma that it causes delays return of bowel function. It slows the patient from eating. It slows them from getting home. So making little small poke incisions and being as precise as possible and just removing just what I need to remove and putting everything back together, as the case dictates, is essential. It's imperative, and it was a difficult process switching from doing being open and laparoscopic to including robotics to now primarily doing robotics. It has been for the benefit of the patients. It has been for, I mean, I'll put it this way. The national average for uh, open colectomy, as far as length of stay, is somewhere between 5 and 7 days in the hospital. My length of stay right now is 2.5 days. And that is
Wow.
all comers coming from taking out a portion of the intestines to taking out all of the colon. It is literally 2.5 days. So I think it's really kind of important to note that, um, and see as time progresses how many people kind of switch over to this platform. But I think it's helped the patients that I treat a lot.
I've had terrific conversations with administrators at Singing River Health System over the last several years about why it's important to continue to invest in the high tech side of what you got to do. But I mean, this technology is not cheap. But it really, I mean, you think about what you just mentioned, the enhanced recovery protocols that have been created by robotics. Um, you have to. I mean, if patient care and recovery, limiting the impact is what is highest on your list as a healthcare facility, then having the best technology is crucial, isn't it?
I completely agree, and I think it's one of those things where, you know, I guess from a business side, you'd call it cost mitigation, right? So fine, it costs a whole lot of money to put somebody, on a robot or to purchase one of these robots, but the amount you save in terms of allowing patients to stay in the hospital a shorter period of time, avoiding some of those surgical site infections, avoiding some of the other issues that historically have been associated with having colon rectal surgery or major colon rectal surgery for diverticulitis, colon cancer, Crohn's disease, etc., is really kind of pivotal.
Yeah. So as a doctor, you mentioned you're used to and you like being able to do the hands-on open surgeries. How difficult was it to make that transition to robotics?
I think because I was trained in the era of laparoscopic surgery and I was familiar with either hand assist techniques where you make an entry and kind of use your hand inside the abdomen while you're still doing some laparoscopic surgery. um, it really kind of helped me understand that transition better. And it was relatively smooth for me, but I understand that it's not always that way. And sometimes you need a little bit of guidance to help get you to that next step.
With Dr. Ramon Brown, it's been a pleasure to spend some time with you today. Keep up the good work, and we really appreciate you joining us today.
And thank you for having me.
Well, as I said, this is a new feature, Singing River Health Talk. When we come back, we'll continue the typical layout of the Ricky Matthews Show. We'll see you after this.